What's up, y'all? It's Dr. Mia and Joseph at Bella Wellness Center, where we offer gynecology, weight management, hormone pellet therapy, laser hair removal, total wellness with supplements, so that in hormone balance, so that we can help you live well, age well, and experience everlasting intimacy. So, how you doing today, Joseph?
I'm good.
What are we talking about today?
We're talking about prioritizing your health, wellness, and family.
Yes. And you know what? I just got a call today from somebody, even on my team at work, where we talk about wellness all the time. She was like, yeah, you said to make sure that you put working out on your schedule. How do you make sure you actually do it? And so my answer for that was one, well, no, she was like, you make a goal to exercise. How do you ensure that you actually follow the goal? And what I said was one, put it on your schedule, like make it working out a big part of your schedule. And I told her to also pick realistic times that will work, and she'll be able to get to it on her schedule. So for me, that's at 6 a.m. in the morning, Monday, Wednesday, Thursday, 7 a.m. on Friday. It is on my calendar. I get a reminder. I get the alarm about 15 minutes before. So I think that's a great start. And then also finding something that you really enjoy doing. So Joseph, you hate working out just like me. But lately you have started to increase your workout and really focus on your health and your wellness. What are some recommendations that you can give that seem to have worked for you to get back on point with your exercise?
I think just being consistent and do it, just make it part of your schedule, like you said, but get a routine. Wake up in the morning, brush your teeth, go work out, whatever it is. If you take a shower before you work out, take a shower, go work out, come back, eat your breakfast, get ready for work, take a shower, get a routine. Mm-hmm. And that's what works for me is, I'm a person of creature of habit. Mm-hmm. So I do everything pretty much the same way all the time.
That's me too.
Yeah. So, I say, get a routine and just make it a habit. And anything you do for 21 days becomes habit, right? Mm-hmm. So, try to get through a 21-day process. Mm-hmm. And that doesn't mean like every day, because it's hard just being busy as we are to do things every day. Mm-hmm. But if we set schedule to do like workout every Monday, like for me, working out every Monday is what I'm trying to do. I'm trying to make sure I work out every Monday and Tuesday, and then off Wednesday and try to work out Thursday or Saturday. If I can get into that routine, but I got to start with working out every Monday. Mm-hmm. So just get into that routine and do the same thing every. Wake up at a certain time, be at the gym by a certain time, mm-hmm. be done by a certain time. Have your workout plan so it's 30 to 45 minutes, whatever you're gonna do. If it's 30 or 45 minutes, have it work out so at 45 minutes you're done. Mm-hmm. Because we have busy lives and we can't really afford to like extra 5 minutes could be an extra 30 minutes somewhere else in our day. Mm-hmm. Or extra 5 minutes means we get stuck behind the buses trying to get out the house in the morning, which means an extra 30 minutes. So try to keep it scheduled and just prioritizing your health and your wellness and the family. The reason for being as healthy as you can and making sure that you're getting your screenings, going to your doctor and doing all that stuff is so you can be here for your family. Mm-hmm. Good friend of ours, his dad, he called him 94, right? And the man is 94 years old. He still cut his grass. Mm-hmm. He at some point in his life, he had to prioritize his health,
right?
In order to be 94 and still be able to cut your own grass. That's when I don't want to cut my grass, but I want to be able to cut my grass.
Which kind of goes back to making sure that you make it a priority, but in a reasonable way for you. So it's not realistic for me to think that I'm gonna be able to go to the gym. I don't have time to go to the gym. Yeah. I just don't have time to do it at all. Right. So what I do is I do virtual training. And I know that there are plenty of trainers who will do the virtual training. So when I wake up, I literally wake up, use the bathroom, wash my hands, throw on some workout stuff, and I already have my stuff set up in the living room.
Right.
And I go do my 30 minutes with my trainer, and I try to do like a 15-minute after that. So sometimes you're trying to go to the gym or trying to go to classes, but it's not realistic for your schedule.
Right.
So just getting in the habit of moving, and those older people who tend to age well, they have been exercising for some time.
And they have a schedule.
It's a part of their schedule, whether it's working in the yard, you know.
Like the people who walk in our neighborhood, I can come out in my garage in time. What time of day it is when they walk past my house, you know, and these are older individuals, you know, husband, wife, they walk past our house every day at almost the exact same time every day. So they prioritize that we're going to get up and do this every day. And it just, you know, our schedule, we could probably work out every day, but our schedule doesn't permit us to do that. It doesn't permit us to do that.
But what you can do, like those people who don't have time to do a lot of working out, you can just schedule stuff throughout the day. So you could do 15 minutes in the morning where you just wake up in the morning, you know, go for a walk. I go up and down my driveway. I don't even go far. And I do that to get my heart rate up. And then you can go do your squats or your burpees, something that you know how to do, making sure that if you don't know how to work out the right way, you go ahead and get that trainer to start so you're less likely to have an injury. But find a way to consistently work out. Some people do better just saying they're going to work out 25 minutes every day versus 45 minutes 4 times a week. So figure out what works for you, because it's so important for your real health and wellness. If you are not exercising, you are not going to age well. You are not going to be able to experience everlasting intimacy. Being overweight increases your risk of breast cancer, all kinds of cancers, all kinds of diseases. So we're not just doing it to age well, we're also doing it to decrease our health risk. And, you know, if you think about chronic pain and all of the older people with the significant arthritis where they're not mobile anymore, they can't get around, they're always having pain. Those people are more likely the people that didn't get a chance to exercise or prioritize exercise in their lives. So we need to be moving. We need to be doing some resistance training, and we need to stretch in order to make sure that we're less likely to get injury and to maintain healthy balance as well.
Exactly. And you got to be consistent, because I noticed once I left my business of home inspections, my
activity level,
my joints. My joints started hurting because I wasn't using them like I was as a home inspector. As a home inspector, I'm going up and down steps, climbing on roofs, climbing under houses, lifting my ladder, lifting my tools, doing all these things all day, taking off covers off of metal, electrical panels and stuff like that. And I'm always doing something in a business. And once I left that business and I stopped doing that physical everyday activity, my joints started hurting, shoulders started hurting. I dislocated my shoulder, didn't know how I dislocated my shoulder. Had no idea how I did it, but I somehow dislocated my shoulder, and it just made my whole body uncomfortable because I wasn't consistently moving every day. I'm sitting at a desk 6 hours of the day now instead of up moving and, you know, the real physical job, because being a home inspector was a very physical job, which I enjoyed, but I never knew how much it was until I stopped doing it.
Right.
So you got to be consistent with your workout every day and consistent movement. What Daryl Griffin say? Move your numbers, right? You know, be consistently moving your numbers, getting your heart rate up and everything, because that heart rate is very important because that builds your stamina. And, you know, we're about, you know, being intimate with each other, and you need stamina to be intimate on a regular basis, right?
And to have fun intimacy, you need flexibility. So kind of like you're saying with the stretching.
Yeah,
you know what I'm saying? Yeah. Being able to stretch on a regular basis.
You want to catch a cramp.
Right. You
don't want to catch a cramp.
Yeah.
You know, so stretching is really important, especially when you get, you know, I don't even know if 50 is considered middle age anymore, because I guess we're getting younger. Over 50, I guess, because we don't look like the 50-year-olds that we grew up with, to be honest. So I don't know if that's middle age now, but, you know, at this point, stretching is even more important than it was when we were athletes and young and stuff like that, because, you know, we just don't move like we used to. I don't play ball no more. You know, I don't even play recreational. So the only thing I play is golf, and I stretched before that, but I stretched before golf, you know, but stretching is way more important now to me than it ever has been, you know, especially, you know, that I have an older back.
Right.
You know?
And then more motivation is that exercise is not just about weight management.
Yeah.
It's not just about intimacy. It's also about feeling good. So you have more energy when you exercise. You sleep better when you exercise. You focus better when you exercise. You're in a better mood when you exercise. And then you decrease health risk with exercise. Right. So definitely a lot of other reasons outside of just managing your weight and having great intimacy. Also, all of those things that just improve your quality of life and the way that you age in general.
And even, you know, we're talking about health, wellness, and prioritize your health, wellness, and your family, right? So even on the health side, we're talking about working out and, you know, and monitoring your blood pressure and things like that, and making sure you're going to the doctor and stuff like that. But even on the wellness side, when we talk about the food you intake and stuff like that, that's even just as important as working out. There's no point in going to work out 45 minutes a day
and then
you
crap.
eat red meat and cheeseburgers
and fast food all day.
And fast food all day. American cheese. Somebody tell me where American cheese is made. You tell me.
In a factory.
It's not American. There's no such thing as American cheese. So, but I mean, and you're eating stuff like that all day, and you're not eating raw vegetables and stuff like that. And I get it. Some people don't like raw vegetables, so you got to supplement.
Or juice.
Yeah, you juice your vegetables. You know, you can make it sweet. You can make it taste well, and it's still going to be healthy for you, even if you make it sweet. But it's no point of working out every day and then eating like crap all day.
Right.
If you think about, you eat 3 meals a day, if all 3 meals are garbage and you work out 45 minutes, where's that balance?
Right.
You're doing yourself a disservice.
So I would say when you're talking about prioritizing health, wellness, and family, it does include meal prep. And that's something that me and Joseph are trying to do more of, because we don't even want our daughter eating out every single day. You know, lunch for school is already a lot of fast food at her school. So we're like, well, if you don't have that at school on most days, let's make sure that you are having some healthy things at home.
And meal prepping doesn't mean that you spend like Saturday or Sunday creating, you know, 7
extravagant meals,
right. or even 7 meals that you put in a dish, because to be honest, we don't like the redundancy of eating the same thing every day. We don't, you know, we probably got 2 days worth of leftovers, and we probably should throw it out after that because nobody's going to eat it. Right. But it does mean cooking more often, like going to the store. Like we just spent 2-3 hours at the grocery store. We hit 2 stores. And we got vegetables, we got meat. We're trying to slow down on red meat. We love red meat, but we know how healthy it isn't for us. Even though we eat good red meat, we just know we can't do it on a regular basis, right? So, you know, getting more chicken. We were trying to find some seafood. We wasn't successful in that. We found a lot of vegetables.
Yes,
and we can do a lot of vegetables. I do. Sheep juice is a beet juice combination for me. I say it's for me, but it's for my blood pressure and keep my blood pressure regulated. And anytime I'm doing a beet juice on a regular basis, my blood pressure stays at 120/80.
And now I make the beet juice taste good. It's not just beets. It's beets and apples and carrots, ginger, mango,
lemon,
pineapple.
Right. So and then the mangoes and the pineapples and the mangoes, those are for other qualities too. You know, because if you do the beet juice about 30-40 minutes before you go to bed, you have some other results as well. So, but
because it helps with blood flow.
It helps with your blood flow. So it's really good for you. So yeah, again, we're talking about prioritizing your health, your wellness, and your family. So what we try to do through us is also keep our family healthy, right? Our son, who's 31 years old, he eats fairly healthy, you know, and the reason why he's fairly healthy because we ate like that in our household. You know, we love, now don't get us wrong. We like love some fast food too. Now,
I don't love it no more because it don't love me. But we have eaten fast food.
We have eaten, and we will eat some fast food, but we are selective. Like we pick and choose where we get our fast food from. We don't do McDonald's. We don't do Wendy's and stuff like that. And people who love it, love it. If you love it, I like it, whatever. But we don't do it because we know it's processed food, and we know the negative effects of that. That's something you can't do every day. Now, periodically we will, but periodically we'll do a Five Guys. Periodically we'll do what's the one you love with the wings and the
American Deli.
American Deli. Now I can tell you right now, we like some American Deli,
but we still don't eat it often. And what made us really stop doing it is COVID. You know, when you didn't really have anywhere to go eat, and so you couldn't go get fast food, and we started cooking at home and getting our meats and stuff. And then we both lost weight. All of us lost weight in the house, and it was because we were not eating out. So it made us realize how much weight you gain with eating fast food and eating out all the time. So prioritizing the meal prep and planning to buy the right things so you can cook at home and eat some of those healthy whole foods from home.
I'm gonna say another thing, Doc, with wellness is paying attention to how your body reacts to the food you eat.
So mindful eating.
Yes, mindful eating. If you eat some food and you're going, oh Lord,
and you feel
2 or 3 hours in, you feel terrible. So you probably, that's something probably you shouldn't eat. Okay. We know immediately, like fried foods, we are done. Like
especially if we get them out.
We fried foods, it's like, oh man, we gonna have a bad night and probably won't sleep. We're gonna be we're gonna be taking turns running back and forth to the bathroom because our body doesn't process fried foods. And it's really because we don't really eat a lot of fried food. But sometimes we want some chicken, we want some fried fish.
And a lot of times we'll put the chicken in the air fryer, but not for fried fish. We put it in that peanut oil. I'm not air frying and fried food is two different things. Yeah.
So we're talking about deep fried grease food. Like peanut oil, I noticed that we don't have a problem with peanut, but I don't know what other people cooking this stuff with. So we get us some fried chicken sometime. It tastes phenomenal. And 2 or 3 hours later, we both sitting there like,
why did we do that? Right? I know. Why did you pick this place to eat?
Another thing, pay attention to the ingredients on your labels. We read labels. You know, I can't eat bread with enriched flours. I've realized that once I started eating it, and as I got older now, as before I had no problem with white bread, wheat bread, anything. But some reason when I turned 54 years old, now I eat regular bread and I blow up. And it's not the fact that I blow up, and I do get kind of blow up gassy in the stomach, but it's more that I feel like I'm just swelling up. It's the feeling of me swelling up. So now I realize wheat flour, I can eat bread with wheat flour. So I eat sourdough bread with wheat flour, and that works out really good. So pay attention to what your body is doing when you eat certain food. If you're every time
reflux is acting up, your body does not want that.
Your body doesn't want that. And don't eat it. I mean, substitute something else. Don't eat it, you know. So what did you say, Doc? I'm sorry.
I think I forgot, but I was just gonna give a few tips about, because I know everybody's in there. You know, we always trying to lose weight. I'm always losing 5 to 10 pounds versus 15 to 20. So some things that you can do, like besides eating the whole food, exercise and more, making sure that as you're aging, what used to work doesn't work now. So a lot of my patients are coming in, they're saying, well, I've been trying to lose weight and I can't lose any, but I've been doing intermittent fasting, blah, blah, blah. So I'm like, okay, what we're fighting against over 40 is metabolism.
Yes.
So to improve metabolism, that requires eating breakfast in the first hour of waking up and eating frequent small meals. That's right. Getting your snacks in, having those fruits with you, having your emergency snacks with you, keeping, like we keep like Cliff Bars with us. So if we know we don't have time to eat.
The Cliff Bars are bomb.
Yeah, and they'll like fill us up, but we make sure we're not skipping meals. And for a lot of people who are busy, you have to set your alarm. So just set your alarm as soon as you eat one meal.
They turn us on to that.
What?
Shout out to Dr. Tracy. I think that's who clips either Dr. Tracy or Dr. Michelle hooked us on those Cliff Bars.
One of them had us getting the Cliff Bars. So those are good. So finding you some healthy snacks that you enjoy with some protein, healthy fat, and you want to make sure you're getting your fiber in, but don't skip meals. Don't eat 2 or 3 big meals a day. Eat breakfast in the first hour. Breakfast for me during the week is a protein shake. We keep them in the refrigerator. As I'm finishing my workout, I should be grabbing one and start drinking that right away. Yeah. And then when I get to the office 2 or 3 hours later, I can have my piece of fruit, or I can have a Cliff Bar. I have, if I wanted to do a real meal for breakfast, boiled eggs scrambled, omelets, making sure you're getting plenty of protein and healthy fat, but doing it within that first hour of waking up or working out if you work out first thing in the morning. Right. And then, like Joseph said, choosing the healthier foods. We eat bread still. We just choose sourdough, and neither one of us get an upset stomach with sourdough bread.
And it's good.
And it's good. And we keep lunch meat in the refrigerator. We'll get it from Sprouts, so we know it doesn't have all that crap in there. But instead of stopping to get fast food when we hungry, we'll come home and make a good sandwich and make it taste real good. Put it on the grill and add some extra stuff like my olive mix. So being creative, keeping you some healthy snacks around, preparing by going to the grocery store, getting the foods that you like, and then making it a priority. We didn't feel like going to the store today. It really wasn't something that we wanted to do to spend that kind of money on food today either. But we prioritize our health and our wellness, and not just for us, but also for our daughter, so that she can grow up and understand healthy habits, develop them, and maintain a healthy lifestyle.
Right. And I didn't have problem spending money. I didn't want to go to the store.
I didn't want to spend money.
There was a lot of people in Costco
today. It was. But thinking about the money part of it, when we go out to eat, if we go out to a decent restaurant, we're gonna spend $150 to $200
and do that 3 times a week.
Yeah, so it was much cheaper to go to the store, get the things we need, and we're gonna enjoy the food so much better because Joseph is an amazing cook, and the things that I do cook, I can make sure that we enjoy them. I won't say I'm an amazing cook, but I can make it happen.
Yeah, it's really important that you prioritize your health, your wellness, and your family, because you're doing it. You're prioritizing your health and your wellness for your family,
right? Because
whatever you don't do today and whatever you don't pay for today, someone will pay for it later,
right?
And God forbid anything happens, disease or anything happens to anyone where they have to have someone take care of them. But you should do all you can do to prevent that situation, to prevent not being mobile at 70, 80, 90 years old. And I want to be 190 years old.
And we know better now.
Yeah.
We didn't know better then. Our parents.
But even foods were not like they were now.
Right. But
foods we ate in the 70s and 80s and early 90s. I'm going to say early 90s and maybe 90s was most definitely like the foods of the 2000s.
It was totally different.
Totally different. Everything is mass produced and they do everything they can to duplicate things that's not even possible.
Yeah.
Yeah. So so prioritize your health and your wellness for your family, because like I said, whatever you don't pay for today, someone will pay for it later, and no one's taking care of you now, and you shouldn't want anybody taking care of you later, because now you're giving control to someone else, to, your life to someone else, to make sure that you're healthy, and I'm not a big pill taking person. So I'm trying to avoid that at all costs. That's the reason for the beet juice, because I don't want to take high blood pressure medicine. I want to regulate it on my own.
He doesn't take high blood pressure medicine because his blood pressure is normal.
Yeah, it's normal.
If he needed high blood pressure medicine, he would, because it's the silent killer.
I would, but I don't want to.
Right.
So
that's why you exercise and
I regulate it using the beet juice. So and there are alternatives to medicine. Okay, but if your doctor say you're supposed to take this medicine to live, take the medicine to live.
And then work on your lifestyle changes so maybe you can get off the medicine.
I've had too many friends have strokes because they will not take their blood pressure medicine, and their blood pressure 200, 250 over some other number, and they have a stroke, and they're young people. They're not 60 and 70 years old. They're 30 and 40 years old, 40-year-old people. So if your doctor says, take your medicine, that's part of your health and your wellness, that's your, take your medicine. But you should also be doing everything to possibly, if you can, get off that medicine. You should be doing it. If you're a diabetic and you have to take insulin, take your insulin.
Right.
Take your insulin. And you should be doing whatever you should be eating, what they call a diabetic diet to help you regulate your diabetes. Do whatever you can. Don't just say, well, I'm taking this insulin, so I'm gonna go ahead and eat this cake,
right?
Eat this cheeseburger.
I'm gonna give me 2 more units extra.
Right. I'm gonna eat this cake, eat this cheeseburger. I'm gonna have these fries. All the foods you ain't supposed to be eating. Don't eat them. We have to sacrifice to live, and you sacrifice for yourself.
And love yourself enough to invest in your health, but invest in your health, the time and the money, so that you can do the things you need to do to live well, age well, and experience
everlasting intimacy.
All right. You got any last minute words? We'll let the people go. We just wanted y'all to focus this week on prioritizing your health, nobody can stop me from my workout in the morning and the things that I need to do to go to the doctor. Nobody can stop me from doing it. Well,
I can stop.
You just got to do it earlier. I still go work out. Even I
can stop. No, we can stop that workout.
Yeah, we can add a little extra before my workout, but I'm going to my workout.
We could text Peggy, be like, we ain't gonna make it. But no, I mean, you got to prioritize. And even for me, like, I know in order to keep this shoulder strong, I got to work out, because that was excruciating pain, and I'm too old to be hurting like that. So in order to keep this shoulder strong, I'm gonna have to go work out. And I don't like working out. And we worked out. Let me tell you, we were 5 o'clock in the morning workout people for years. We would get up and drive 20 minutes to the gym and work out at 5 o'clock. And I weigh now what I weighed 25 years ago. So
I weigh more.
So now I got to work out if I want to keep my weight where it was 25 years ago, because I weigh now what I weighed 25 when we met 25 years ago. So almost to the day.
I know. Well, August 30th is when we started dating.
Yeah, 25 years ago. So live well, age well, have everlasting intimacy, and prioritize your health.
Yes.
If you're supposed to take
your medicine. It's not selfish to prioritize yourself and your health.
And you're being selfish if you don't do it. You need to be selfless and make sure you take care of yourself for your people, because somebody needs you.
All right, y'all. Y'all go live well, age well, and experience everlasting intimacy. This month, we finished all our stuff for this month. So if you can catch the replay, we talked about adolescent health, why you should bring your girls to the doctor, what a normal cycle is. We talked about contraception and a lot of things. So if you can catch the replay, catch it, share it, and then we'll see you this September where we're launching our podcast. At Ageless Vitality. So we will keep you informed and in the loop so that y'all can be a part of our amazing.
And watch if you have young women in your family, adolescents, teenagers going off to college, watch the replay of the adolescent health webinar. There are a lot of tips in there to help you with your young people, especially these young ladies, and a lot of things they should be doing while they're going to school, and things to help regulate, the women things that y'all go through. So
catch the replay, and we'll see y'all September 20th or something like that.
Yeah, September 20th for the next webinar. The next webinar, I believe, is September 20th. And I think we're back on...
Oh, it's the 17th. So the next webinar is September 17th. And we're doing our podcast launch on the 21st.
And I think we're back on Ageless Intimacy on the
15th. Something like that. All right, y'all. Have a good one. Peace.
Deuces.